COVID-19 can be characterized as a pandemic.
The coronavirus is a pandemic.
Many schools around the world, as you know, have shut down.
It's going to have a huge impact.
I mean, it just starts blowing my mind that we just didn't even think about this. We just sent everyone home, assumed that they had a computer or a tablet or a printer, assumed they had internet.
Oftentimes, my video will freeze and then it will crash.
There weren't structured classes, and that we basically just got handed sheets, and I wasn't able to reach my teachers like I could during school.
I've never said this before, but I miss school.
It ruined our graduation and ruined the rest of our senior year.
I definitely feel a little more frustrated and sad.
I definitely know a lot of people who are struggling with depression and anxiety.
I'd say I've retreated to a more isolated version of myself.
My name is Susanna Fox, and I'm a co-author of the report. Unfortunately, what the survey shows is that depression rates among 14 to 22-year-olds has gone up significantly since 2018.
Young people who are people of color and living in communities that are low income, where there are a lot more essential workers, they have been disproportionately impacted by COVID. So they're much more likely to be depressed than peers.
I have a friend who has some family troubles, and I feel like her stress has been amplified now that, like, with quarantine and stuff like that.
Just really not knowing how things are going to turn out and just rethinking your future and your life. And it really took a toll on me.
Social media is a place that can be used for great things and connections and positive impact, but it's also a place where it can be used for comparison and self-doubt.
We're seeing that young people report instances of body shaming, racist remarks, sexist or homophobic comments, and that these are up slightly higher than what we saw in 2018.
So even as teens go online to connect with each other and try to seek inspiration and community, they are unfortunately also finding hate.
I've now taken control over how much I use social media and what ways I am going to use social media.
One of the encouraging findings is that teens and young adults are proactive. They're going online to take depression screeners. They're going online to try and find that health app that they think could really help them.
Nearly half of the young people studied in this report said that they engaged with a health provider online.
You need to have your fingertips for the resources and tools to help you get through those tough days.
Being able to use telehealth as a way to reach populations that otherwise might have difficult access.
We have to support teens being aware of what they can and will see on social media and help them bolster their ability to cope with it when it exists.
As this young population comes out of the pandemic, we just need to stay very attuned to what their mental health needs are.
Even if it feels safer to keep to yourself, to ask for help.
It's okay to ask resources. It's okay to go to therapy. It's okay to build your own personal toolkit to make you have a better day each and every day when it's hard.
If you see your teen or young adult spending all their time on the phone, it might actually be that they're taking care of themselves. They are reaching out. And what we need to do is meet them where they are. And they're online.